Thank you, Sahani sir and Neha Kakal. And good evening, good afternoon, and good morning. This is the 1611th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Neha Kothadiya, and she is working as an assistant professor, Department of Veterinary Medical, BG Garia Homeopathic Medical College, Rajkot, Gujarat. So let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi. That is from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the same can watch it again, and you can subscribe the same without paying any money. You can share it with your friends, so thereby our target of reaching homeopathy every home around the world, and I hope all of you will do the same for promoting homeopathy, and not only for the IFPH but for the homeopathy itself. So this is what we have to say about the forum and the introduction. And as we all know that today our guest is Dr. Neha Kothadiya, and she is, as I told you earlier, working as an assistant professor in the Department of Veterinary Medical, BG Garia Homeopathic Medical College, Rajkot, Gujarat. And today the subject to be discussed here is scope of homeopathic medicine in sciatica. As you all know, homeopathy is a system which works by every part of the human body, in both in mind as well as in physiological aspect as well as anatomical aspect also. Whatever be the disease, it doesn't matter much. What matters is the patient. So treat the patient is what is homeopathy is supposed to do. And let us see what Dr. Neha Kothadiya has to say about all these things. So we welcome Madam to this session. Welcome.
Thank you, sir. Thank you, sir. Thank you for inviting me.
Yes.
Good evening, everyone. First of all, before the start, I would like to thank you, IFPH Talk, for providing such platform. I would like to thank Sahani sir. I would like to thank our HOD, Dr. Krishna Madam, for providing me such an opportunity to share my knowledge. Let's begin the session. Today, my topic is the scope of homeopathic medicines in the sciatica. As we all know, the sciatica is one of the major lifestyle disorder we are facing today. With the modernization of all the lifestyle, sedentary lifestyle of the human being has created the several disharmonies in the human bodies. So, extra traveling or extra occupation leads to the sciatica. Sedentary life often complicates the problems like the hypertension, diabetes, sciatica, etc. Is the all know sciatica itself, the name suggests that sciatica is the term for the pain that radiates along the sciatic nerve from lower back to the buttocks down to the posterior side of the lower extremity. Sciatica pain, generally with the pain there is a weakness and the numbness which may take longer to resolve. In homeopathy, we all know all the medicines are work wonderfully, but today in this session, we will discuss the major impact for the sciatica medicines. In homeopathy, we don't only aim to cure the particular disease condition, but more towards the holistic approach for the treatment for the whole person by addressing all the aspect of the individual, that is his physical build-up, mental and emotional makeup, whether his past history, family medical history, his desire, aversions. From all these things, we will take the totality of symptoms. We consider all these symptoms, mental genres, physical genres, as well as the particular peculiar symptoms. And for the treatment of the sick person, we will prescribe the medicines. In homeopathy, we can provide the relief from the doubt pain and show the overwhelming positive response from the controlling the inflammation of the sciatic nerve as well as the controlling the irritation of the sciatic nerve that results in the cause of the sciatica. Let's understand the sciatic nerve first. As we all know, the sciatic nerve is the thickest nerve in the body. In its upper part, as we can see here, in its upper part, it is from a 2 centimeter wide band. It begins in the pelvis and terminate in the superior angle of the popliteal fossa by dividing into the tibial and common peroneal nerves two portions. The sciatic nerve origin root value of the sciatic nerve is L4, L5, S1, S2, and S3. The tibial part is from the L4, L5, S1, S2, and S3. The dorsal part or the common peroneal part is formation from the L4, L5, S1, and S2. As we all know, in the pelvis, the nerve lies in the piriform. This is the very special muscle because again we see this muscle in the causation of the sciatica piriformis syndrome. If this muscle is inflamed or any kind of deformity is there, then it will lead to the sciatica. In the gluteal region, sciatica now runs through the gluteal region through the greater sciatic foramen below the piriformis muscle. It runs downward with a slight lateral convexity passing between the ischial tuberosity and the grotter trochanter. It has the following relation in the gluteal region: superficial or posterior side, gluteal maximus, deep or anterior body of the ischium, tendon of the obturator quadratus femoris, obturator externalis, the capsule of the hip joint, and the upper transverse fiber of the abductor magnus. In the medial part, inferior gluteal nerve and the vessels is present. In the thighs, the sciatic nerve enters back of the thigh at the lower part of the gluteus maximus, runs vertically downward up to the superior angle of the popliteal fossa at the junction of the upper 2/3 and the 1/3 of the thigh. There is terminated dividing into tibial and common peroneal nerve. Branches: articular and muscular. Articular branches to the hip joint arise in the gluteal region. Muscular branches to the tibial part of the sciatic nerve supplies the semitendinous, the semimembranous, the long head of the biceps femoris, and the ischial head of the adductor magnus from its medial sides. The common peroneal part supplies only the short head of the biceps femoris. Motor functions. Although the sciatic nerve passes through the gluteal region, it does not innervate any muscle there. The sciatic nerve does not directly innervate the muscle in the posterior compartment of the thigh. साइटिक नर्व ग्लूटल रीजन के थ्रू पास होती है, लेकिन वो पोस्टीरियर पोर्शन को है वो सप्लाई करती है मेनली. द साइटिक नर्व आल्सो इनडायरेक्टली इंटरवेट्स द सेवरल अदर मसल्स via its two terminal branches, that is namely tibial nerve and common fibular nerve. Sensory functions. The sciatic nerve does not have any direct cutaneous functions. It does provide indirect sensory intervention via its terminal branches, that is tibial nerve and the common fibular nerve. Now, the tibial nerve supplies the skin of the posterior lateral leg, lateral foot, and the sole of the foot. The common fibular nerve supplies the skin of the lateral leg and the dorsum of the foot. Now, the topic, sciatica. What do you mean by sciatica? Sciatica, as the name suggests, it is a pain that runs through the sciatic nerve. That is, shooting pain along the cutaneous distribution of the sciatic nerve and its terminal branches, that is chiefly the common peroneal nerve, is known as the sciatica. Pain usually begins in the gluteal region that radiates all the part of the back of the thighs and the lateral side of the leg and the dorsum of the foot. That is known as the sciatica. Now, some historical aspects. The term sciatica is derived from the Latin word ischiadus, meaning of the pain in the hip. The ancient Greeks were familiar with the sciatic neuralgia and used the term sciatica to describe the pains or ischias felt around the hip or the thigh. Hippocrates himself referred to the ischiatic pain affecting men between the 40 to 60 years. As we all know, the sciatica majorly affect in the adults, that is where the age varies from the 40 to 60 years. The Italian anatomist Domenico Contini wrote the first book of the sciatica in 1764. For the many years, it was known as the contiguous 30s disease. He was the first to distinguish sciatica due to the nervous disease from the aching pain associated with the lower back pain. By the 19th century, sciatica was thought to be due to the variety of the rheumatic conditions causing the inflammation of the sciatic nerve. However, Early frustrations with the difficulties in identifying a cause of and treating the sciatica were expressed by Fuller in his book for the rheumatism, gout, and sciatica. He stated the history of sciatica is it is must be confessed the record of the pathological ignorance and the therapeutic failure. In 1867, Lasik first tried to associate sciatica with the backache, describing the posture gait in the sciatica. He also devised the sciatic nerve stretch test, which is also known as SLR test. Now, the epidemiology of the sciatica. The sciatica prevalence is the 1 to 10% of the population, majorly varies from the age group of the 25 to 45 years. A number of environmental and inherent factors through the influence for the development of the sciatica, including the gender, body habits, parity, age, genetic factors, occupation. Occupation play the major role for the development of the sciatica. Who is constantly in the sitting posture or constantly on a standing posture may lead to the sciatic complaint. Body height may be a risk factor for the sciatica, although this appears to be significant only in the males in the 50 to 64 years of the age group. Sciatica. The age incidence of the sciatica mostly related to the age, releasing before the age of the 20s. Incidence peak in the fifth decade and declines thereafter. Sciatica most commonly affect the people during the 40s and the 50s. The odd ratio of the episode of the sciatica increased by the every addition of the 10 year of the age up to the age of the 64 years. Although the majority of the disc herniation occur at the level of the L4 and L5 or the level of the L5S1. Disc herniation is the major cause for the sciatica. With the advancing age, there appear a relatively increased evidence of the herniation at the level of the L3, L4, or even at the level of the L2 and L3. Gender. Men are more prone to suffer from this disease condition rather than the females. Occupations that required a heavy physical laborious work are more affected. So the male are more frequently suffering from the sciatica rather than the females. Now the risk factors. What are the risk factors for the causing this disease condition? As we all know, first of all, the age. Second is the obesity. Third one is the prolonged sitting. Fourth one is the diabetes. Fifth one is a sedentary or inactive lifestyle. Risk factor for the sciatica include the any traumatic condition, road traffic accident, or any kind of trauma to the back, or any kind of trauma to the spine. On accounts the activity, age, smoking, obesity, vibrating, like the driving, long continuous driving for the truck drivers or any car drivers, lifestyle disorders. Although the body mass may have been associated with the low back pain, body height may be at the risk of for the development of the sciatica in the age group of the 50 to 64 insignificantly in the male. Now, occupation may play the important role for the development of the sciatica. Physical activity associated with the occupation has been shown an influence in the incidence of the sciatica. Carpenter, farmers who are heavy lifters are prone to the disease condition. Awkward working position, working on a flexed or twisted trunk, it is possible that development of the sciatica in this individual may be increased. Occupation like the machine workers are heavy increased chance of the development of the sciatica. Approximately 90% of the cases are caused by the herniated disc involving the nerve root compression for the development of the sciatica. Now, what are the causes for the development of the sciatica? As we all know, when there is a compression or irritation of the sciatic nerve, that may lead to the sciatica. Sciatica can either be cause of the inflammation of the sciatic nerve or because of the compression of the sciatic nerve resulting in the sciatica. Inflammatory conditions like the sciatic neuritis or arachnoiditis or nerve root compression like a herniated disc are the most common cause of the development of the sciatica. Lumbar spinal stenosis, spondylolisthesis, piriformis syndrome, spinal tumors, and the inflection are the rare disease condition, but it may be cause the development of the sciatica. Other causes: pregnancy, bone spur, abscess, obesity, hematoma, mechanical injuries are the other causes for the development of the sciatica. What are the common causes that develop the sciatica condition? There are several spinal disorders that can lead to the sciatica as we discussed earlier: herniated disc, spinal stenosis, trauma, peripheral syndrome, spinal tumors. These are the common cause for the development of the sciatica. Now, We can see all the causes one by one. What is the herniated disc? Herniated disc is a bulgy disc is known as the content disc disorder. This means the gel-like center remains the content within the tire-like outer wall of the disc. A herniated disc occurs when the nucleus breaks through the annulus. It is called as a non-contaminated disc disorder. Whether a disc bulges or a herniated disc material can press against an adjacent nerve root and compress the delicate nerve tissue and causes the sciatica. This is due to the irritation of the sciatic nerve and the compression of the sciatica nerve. The consequences of the herniated discs are very worsened. Not only the herniated nucleus causes the direct compression of the nerve root against the interior of the body spinal canal, but the disc material itself also contains an acidic chemical irritant, which irritates the sciatic nerve and causes the inflammation of the sciatic nerve and leads to the radial pain that leads to the sciatica. In both the cases, nerve compression and the irritation causes the inflammation and pain in the sciatica, often leading into the extremity numbness, tingling-like sensation, and the muscle weakness. Now, the spinal stenosis. Spinal nerve roots branch outward from the spinal cord through the passageway made of a bone and ligament called the neural foramina. Nerve roots passes through the openings and join each other, become a nerves, and extend out the rest of the body parts. When the spinal stenosis develops, this foramina become the narrow or clogged. The nerves get compressed. The decrease in the spinal space within the canal is typically the result of the disc herniation, and the causes for the spinal stenosis are the injuries to the spine, the development of the bone spur, and the thickening of the ligaments. Spondylolisthesis is a disorder that may often affect the lumbar spine. It is characterized by one of the vertebrae slipping forward over the adjacent vertebra. Whenever a vertebra slips and displaced, the spinal nerve root compression occur and often cause the sciatica leg pain. Spondylolisthesis is categorized as the developmental or acquired form of spinal degeneration, trauma, or physical stress. Trauma. It is a very important one. Sciatica can result from the direct nerve compression caused by the external force to the lumbar or sacral spinal nerve roots. Example includes motor vehicle accident, falling down, football, other sports, etc. Fragments of the broken bone may compress the sciatic nerve. Spinal tumors. It is a very rare condition but may be developed. Spinal tumors are the abnormal growths that are either benign or cancerous, that is malignant. Fortunately, the spinal tumors are very rare. However, when a spinal tumor develops in the lumbar region, there is a risk of the development of the sciatica from the result of the nerve compression. Malignancy causing the compression along with the extra spinal cause of the sciatica were noted in 32 cases in the sciatica. Other rare malignant causes of the sciatica include the hemogloblastoma on the sacral root and the lung adenocarcinoma metastasis in the pelvis. That are the other malignant causes for the development of the sciatica. Now we will see the peripheral syndrome. That is a very important muscle that lies, sciatica now lies behind this muscle. It is named from the piriformis muscle and the pain caused when the muscle irritates the sciatic nerve. The piriformis muscle is the lower part of the spine, connects the thigh bone and assists the hip rotation. The sciatic nerve runs within the piriformis muscles. The piriformis syndrome can cause the sciatica when the muscle spasms or becomes inflamed. Inflammation can cause the muscle swell and compress the sciatic nerve, whereas the muscle spasm may impact people whose sciatic nerve runs through the muscle itself. It is because the sciatic nerve gets squeezed as the muscle contracts and the result into peripheral syndrome and causes the sciatica. We can see here the different causes, that is peripheral syndrome, where the muscle and bone compresses the nerve, the degeneration disc disease, spinal stenosis, herniated disc. All these conditions results into the irritation and compression of the sciatica and the radiating pain all through the lower limb. Other non-discogenic causes where the disc is not involved. Mechanical compression of the lumbar nerve roots by an osteophyte around the sacroiliac joint has been described as the causing of the sciatic pain. Also described as the sciatic nerve impinging by the epidural adhesions, uterine fibroids, and the cyclic sciatica associated with the endometriosis in the area of the sciatic nerve. Many times, pregnancy and obesity may cause the compression of the lumbar nerve root causing the sciatic pain. In advanced stage of the osteoarthritis of the spine, bits of cartilage may break off and float around the inside of the spinal joints. This causes the irritation, inflammation, and if occur in the lower back, may put a pressure on the sciatic nerve. Inflammation or abscess formation in the spine may also lead to the sciatica. What is the physiology behind the sciatic pain? Radicular pain from the particular nerve root complex or dorsal that radiates from the spine to peripheral tissue along the concerned peripheral nerve. It is usually manifested in the form of the paresthesia, pain, and numbness. Usually, patient came with the complaint of the numbness, tingling, and pain in the whole lower limb. In radicular pain, the nerve root can be clinically involved in the two ways: nerve root compression or a nerve root irritation. What are the symptoms for the sciatica? Usually, the sciatica affects only one leg at a time. The symptoms may be radiate from the lower back to the buttocks to the thighs to the down the whole leg. Sciatica may cause a pain in the front, back, or sideways of the thighs or the leg. A few common symptoms are seen in the sciatica are as follows. Pain. Sciatica pain may be constant or intermittent. The pain is usually described as a burning sensation or a sharp electric like a shooting pain. As we all know in the cholesynthesis, sharp shooting electric like pain. The pain is usually more severe in the leg compared to the back. The leg pain commonly occur more in the calf region below the knee compared to the parts of the leg. So many a time patient confuses the leg pain with the sciatica. Often pain extends from the lower back all the way through the back of the thigh down through the leg, depending on the way the sciatic nerve is affected, also extend to the foot or toes. Altered sensation, numbness, tingling, and or pins and needle sensation may be felt at the back of the leg. Weakness. Weakness may be felt in the leg or a foot. A feeling of a heaviness in the affected leg may be it is difficult to lift the foot off the door. Change in the posture may aggravate or relieve the sciatica pain. Certain posture may affect the sciatica pain, that is, worse while the sitting, worse while trying to stand up, worse while sitting for the longer period of time, bending forward, twisting the spine, or while coughing. The sciatica pain may be worsened. Pain may increase or remain constant while in the lying down. Many a time sciatic pain relief after the rest, but sometimes it may increase or remain after while down, causing the disturbed sleep, lying on the back with the knees slightly elevated and the propped up the pillow or lying on the side with a pillow between the legs may help to relieve the pain in such cases. The pain may be relieved while walking, applying a heat pack or a red pelvic area or doing the pelvic exercises. Pain is usually the first symptom in the sciatica. Patient may be present with the sciatica pain. The first and foremost symptom of the patient is the pain in the lower lip. Pain usually occurs from the irritation and the inflammation. Most commonly, a sharp, burning, shooting type of pain felt that affect the only one side of the leg. A few examples of the pain that may be also include like electric shock, like shooting pain, throbbing or a pulsating pain, constant dull aching pain, discomfort that comes and goes. Daily sciatica may affect both the legs. That may be also a possibility. Neuralgic symptoms that may be accompanied with sciatica pain. Which are the neuralgic complaints? Weakness in the thighs muscle, weakness in the leg and foot muscles, numbness and paresthesia. If these symptoms persistent, one may consult the doctor immediately. According to the nerve root affection, the sciatica pains differs. If the L4 nerve root is involved, the pain in the hip, thigh, and middle areas are present, loss of sensation over the inner thighs, weakness in the thigh muscle and the hip muscle that help pull together leg, loss of the tender reflex in the knees may be present if the L4 nerve root is present. If the L5 nerve root is present, then the lateral part of the thigh and the lateral part of the leg is involved. Loss of sensation over the great toe and the second toe is present. Weakness in the buttock and leg muscle is present. Difficulty in moving in the ankle and lifting the great toe part is present if the L5 nerve root is present. If the S1 nerve root is involved in the formation of the sciatica, then the pain in the buttock, back, calf, and the side. So the majorly S1 nerve root compression are known as the classic sciatica symptom. Loss of sensation in the outer side of the foot, including the third, fourth, and fifth toes. Difficulty while raising the heel off the ground when walking the tip toes. weakness in the buttocks and the foot muscles, loss of tender reflex in the ankles. Sciatica pain mostly occurs when the nerve roots are irritated due to the inflammatory conditions such as the herniated disc or the muscle spasms. Diagnostic criteria from which we can diagnose that the patient is suffering from the sciatica. Clinical history and findings. From this, all the pain site or areas we can diagnose the sciatica. The one and foremost test for the sciatica is SLR test, that is straight leg rest test. LASIK test and the other investigation like the X-rays or MRIs. For the neurological science testing, motor testing, sensation testing, reflexes are very important. Knee reflex to test the L4 nerve root, ankle reflex to test the S1 root. And the very important test is straight leg raise test. The patient for to perform this test, patient is in the supine condition. The examiner raises the leg straight one after the another up to the 30-degree nerve is not put under the stretch. Between the 35 to 70-degree nerves come into the contact with the prolapsed disc and the patient complains of the pain. Beyond 70 degrees, the patient complains of pain is usually not due to the disc prolapse, but could be due to sacroiliac joint involvement. Now the LASIK test. This test is also for the sciatica or other neurological disorders. Here the hip is flexed, the knee is flexed, and the leg is slowly straightened. The patient is supine, flex the patient hip and the knee to 90 degrees. The nerve roots are not under the tension and no pain is elicited. Not extend to the knees. If the patient complains of pain, the test is positive and it indicates the nerve root compression or the inflammation. We can do the X-rays, MRI, CT scans, or sometimes images. Sometimes the patient may relieve from the physiotherapy, relief of a pain, the restoration of the movement, or the straightening of the muscles. Analysis of the participating factors to reduce the reoccurrence. Heat pad may relieve the pain. Corsets wearing may relieve the pain. Posture education is very important. If the person is working continuously in a flexed position, then the posture education is very important. From the side of the modern medicine, they usually prescribe the NSAID and the muscle relaxations for the sciatic pain. Surgery may be advised in the cases where the herniated disc is there. For the management of the sciatica, we can advise to maintain the good posture. No, do not smoke. Maintain a healthy weight because the obesity is the risk factor for the development of the sciatica. Choose the physical activity. Keep us safe from the falls. Now, the very important one, homeopathic approach for the sciatica. The biggest advantage of the homeopathy that they also treat the pain very effectively. Not only it is relieve the irritation and relieves the compression, but also the pain improvement is there. Another great benefit for the homeopathy for the treatment of the sciatica is the strengthen the patient constitution in order to prevent a further recurrence of the sciatica. Homeopathy, as we all know, is based on the law that is like cures the like. In the homeopathy, we will give the similar medicine to the patient for the curing of the sciatica disease condition. As we all know, we work on the law of the individualization, law on the simplex, law of the minimum. Hence, every individual suffering from the sciatica must consider homeopathy to provide the relief and the reduction of the chance and the recurrence. Homeopathic treatment can change a person's life from the distress to one healthy lifestyle. There are many different remedies for the curing of the sciatica. The first and foremost is Arnica montana. As we all know, Arnica montana is a great medicine for the trauma, where the recent or remote traumas are there. Arnica is suited when any type of injury, however remote, seems have caused of the person trouble after the traumatic injuries. There is sore, lame, bluish feeling, and the aggravation is from the touch there. Then the Arnica is to consider. Arnica is also a remedy for the sciatica due to the overexertion. When the muscle is overexerted, we can prescribe the Arnica medicine to that person. Followed by the sensation of the bluishness, pain while the sitting condition, somewhat relieved by the walking, entirely relieved by the lying down. Sciatica worse sitting and better by lying down is the key indication for the Arnica medicine, which is aggravated by the least touch, motion, rest, and damp cold weather, and the pain is ameliorated after the lying down or with the head low is the indication and modality for the sciatica. Fear of touch is great in the arnica montana. Approach of the anyone or fear of touch is a main indication of the arnica. Inability to perform a continuous active work, nervous, cannot bear any kind of pain. Whole body is oversensitive, wants to be let alone. Everything on which he seems lies too hard, complains constantly of it and keeps moving from one place to the another place in search of a soft spot. It bets in the plethoric, dark-haired person with the rigid muscular fiber, nervous sanguine person. It is specially adapted to the person who have a respiratory troubles. The key symptom of the arnica is soreness, lameness, bluish feeling, afraid of being touched, want to be let alone, and everything on which his life seems too hard, complains constantly of it and keeps changing the position. These are the key indication for the prescribed arnica montana in the cases of the sciatica where the trauma is main thing, element after the trauma, recent or a remote injury. Now, the second was medicine to prescribe for the sciatica is arsenic album. We all know the arsenic is belong in the trio of the burning, one of the major burning remedy, where the burning is a coal of fire, burning pains, trembling, twitching, spasm, and weakness. Arsenic is a weakness medicine. Too weak to move, mentally restless होते हैं. Arsenic patient is mentally restless but physically too weak to move. Heaviness and uneasiness. Weakness in a small part of the back. Pain and burning in the back. Among these, all the prevailing debility, exhaustion. As we already discussed, mentally restless होता है patient but physically too weak to move. Burning is relieved by heat is a key symptom of the arsenic alb. Along with that, great exhaustion after the slightest exertion, irritable, weakness, degenerative changes, and sometimes the paralysis of the lower limb may be with the debility present, which is aggravated after the midnight. As we all know, arsenic modalities are the aggravated in the midday and midnight are the key feature of the arsenic, which is ameliorated after the heat. Though is burning present, but arsenic patient felt better when applied the heat from the head elevated and the sitting erect or in the open air. Arsenic is a restless person. Great anguish is present there. Fear of the death is well marked in the arsenic. The great fear of the cold sweat is there. Fear of being left alone is also present. Great thirst of the drink, but drinks the little water at a time. Great, and the patient is very restless at the time of the night. Now, belladonna. Neuralgic pains come, go, and go suddenly. As we all know, belladonna is the violent medicine, and the belladonna is indicated in the every first stage of the inflammation. Here, the shooting type of pain in the lower limb. Leg refuses to service in the morning. One cannot lift his leg from the bed. Heaviness and the coldness in the extremities. There is neuritis in the nerve, which is aggravated from the motion, touch, jar, noise in the noon, emulated by the warmth and the erect posture. Belladonna may associate with the hot red skin. As we all know, the belladonna is a plethoric person. So the redness of the face is there, glaring of the eyes, throbbing carotid pulse, throbbing type of pain is present in the belladonna. Restless sleep, hyperesthesia of all the senses, neuralgic pains that is violent, come suddenly and goes suddenly. Sleepy, but person cannot sleep from the sciatic pain. Colosynthesis. It is a very good medicine to prescribe in the cases of the sciatica. The most important remedy for the sciatica is the colosynthesis. The worst of the worst case of the sciatica usually respond with this medicine. There are the pain with the sciatic nerve extending to the knee to the heel. Worse from the any motion, especially aggravated by the cold. Pain in the paroxysmal followed by the numbness and the partial paralysis. There is a sensation which has been found described as the thigh were bound with the iron bands, as of thought screwed in a vice. Very painful situation. The muscle is fearfully tensed and fixed. Particularly in the right side is involved, but the colosynthesis in the repertory, we will see that colosynthesis right-sided sciatica as well as left-sided sciatica. In both sided sciatica, colosynthesis is a very fine medicine to prescribe a patient. Stitches during the walking, sensation of the constriction around the hip, spasmodic type of pain, electric shock-like of pain. It is a key symptom of the colosynth. Pain too may come suddenly and leave suddenly, as we seen in the belladonna. They may be sticky and the burning, and all worse from the cold damp at a night when the patient can find no easy option for the limb. Colosynth typifies the sciatica due to nerve changes with no special inflammatory conditions attending it. Sciatica left-sided joint tearing pain, better by the pressure and heat, worse by the gentle touch. Pain down the right thigh, muscle and tender feel too short, numbed with the pains, which is aggravated from the anger and indignation. Ailment after, we all know the colicky, also after the anger, colicky pain, also after the indignation, the keynote of the colosynth medicine. Emerged after the doubling up. Here in the colosynth, colicky pain and sciatica both are emerged after the doubling up, hard pressure, warmth, lying with the hand bent forward. We will see this modality in also the neck force medicine. Now the diascoria villosa. Sciatic pain, right shooting down the thighs with the burning numbness worse from the motion, sitting up better by the standing on the toes, lying still, pains are unbearable. Twisting, riding radiates to the distal part, which is aggravated lying down condition. Doubling up at the night, emerged by the hard pressure, standing erect, stretching out, or a bending back. Diaspora villosa and the colosynth both are very fine medicine to prescribe when the patient is suffering from the sciatica. Colosynthesis is the both-sided sciatica, right-sided as well as left-sided. The diaspora villosa in the right-sided sciatica, where the better by the standing on a toes, standing condition is the better, and the immersion after the hard pressure is present, then one can thought of the to prescribe the diaspora villosa. Now, the nephilium, very important one. Nephilium is the one of the greatest standbys in the treatment of the sciatica and the lumbago. The pain along the course of the sciatic nerve and its larger ramifications is the intense. Numbness is generally associated with this pain. Here, the modalities of the nephilium is very important. In the nephilium, the immersion after the flexing leg on the abdomen is very important one, or embedded after the sitting on a chair, which is aggravated the pain after the motion, lying down, stepping, and walking. The immersion modality of the nephilium is very important. If the patient say that he will relieve the sciatic pain by the flexing his leg on the abdomen, then the medicine is the nephilium. Or the sitting on a chair relieves the sciatic pain, the medicine is the nephilium. Now, the lachesis. As we all know, the aggravation in the sleep or aggravation after the sleep is the key indication of the lachesis. Lachesis always slips into the aggravation and the ailment after coming during the sleep, left-sided. Lachesis is a left-sided medicine. So here the left-sided sciatica is very well marked. In the spring, warm bath, pressure or constriction. All the things aggravate the lachesis complaints. And the hot increase appearance of the discharge and warm applications, all these things are impression from the lachesis patient. Here, the patient feel restless, uneasy, and along with that, the mentors of the lachesis is very important. The patient is suspicious, jealousy, religious melancholy is present in the lachesis. Along with that, he cannot bear the constriction around the throat or around the waist is a key indication of the lachesis. All the natural discharge are the relief point of the lachesis. Appearance of the menses or sweating is the impression for the lachesis patient. Lycopodium. As we all know, lycopodium is a fear of being alone is a key indication of the lycopodium, and the lycopodium is generally aggravated in the afternoon, where 5 to 7 p.m. or 4 to 8 p.m. is the aggravating time for the lycopodium. Craves everything warm. Lycopodium wants everything warm, very hot. He eats food in the very warm. There's a poor circulation called extremities. Pain come and go suddenly, sensitive to the noise and outdoors. Patient fear of being alone. Patient do not want to alone. Sciatica worse on the right sided. As we all know, the lycopodium is a right sided medicine. So the sciatica here is the right sided and limbs go to the sleep in all the cases. There is a numbing type of sensation, tingling up type of sensation present in the sciatica. Pain also in the lumbar is there, pain in the small of back, numbness also drying and tearing in the limbs, especially while at the rest or at night, which is aggravated after the right side, from the right to the left side, from the above to the downwards. The time modality of this arsenic and the time modality of the lycopodium is very important. Arsenic generally aggravated in the midday and midnight. Lycopodium is aggravated from 4 to 8 p.m. from the heat or a warm room, hot air, bed, warm applications, which is generally emitted by the motion from the warm food and from the drinking the warm drinks on the getting the cold or being uncovered. Now, the important medicine. Magnesia phosphorica, the great antispasmodic remedy. We all know magnesium phos is a very fine medicine to prescribe in a colicky pain also, in the sciatica also, and in the dysmenorrhea also. Tempering of the muscle with the radiating pain, neuralgic pain relieved by the warmth, specially suited to the tired, languid, exhausted subject, paralysis agitans, sciatica. The feet is very tender, darting type of pain, general muscular weakness, weakness in the arms and hand, fingertips stiff and numb, right-sided aggravation, cold touch aggravation, night aggravation, and the general emersion of the neck force in every condition, colic, dysmenorrhea, or a sciatica. In every condition, emersion for the sciatica, emersion for the neck force is a warmth, bending double, and the pressure and the friction. The important medicine, Nakshomika. From its action on the spinal cord, the nux is frequently the remedy for the sciatica pain. It is lightning like a pain, like an electric shock-like condition, which we can see in the colosynth also. Twitching type of pain, violent pains, one has to change the position. Pain shoot down into the foot, the limb is stiff, contracted, and the part feel as if paralyzed and cold. Better when lying on an affected side. And from the application of the hot water, constipated bowels, not satisfactory stool. There is a desire to pass the stool, but non-satisfactory stool is present, which is aggravated from the eating spicy food. The typical Nux patient is rather thin, spare, quick, active, nervous temperament, irritable temperament. The person is a zealous one. He does a great deal of the mental work. The person is very irritable, sensitive to the all kind of external impression, light, noise, sound, etc. Cannot bear the noise, odor, light, anything. Backache in the lumbar region. Sitting is a very painful, burning type of pain in the spine, which is worse in the 3 to 4 a.m. Every pain is aggravated from the mental exertion. Sleepy in the afternoon. Cannot sleep in the early noon. After the eating, touch dry weather cold from a nap in the evening while at a rest in the damp wet weather and strong pressure. Nux is a very good remedy for the GIT disorder also. Phosphorus. As we all know, the phosphorus personality or the phosphorus constitution is a tall, slender, narrow-chested with a thin, transparent skin weakened by the loss of the animal fluids with a great nervous stability. Emaciation is there, great sensitivity to the external impression. Paralytic symptom is present, weakness of the spine, burning in the back. As we all know, phosphorus, sulfur, and the arsenic are the trio of the NEHA for the burning. Pain is of the broken hit between the shoulder blades, weak spine, which is generally aggravated by the touch, physical and mental exertion from the twilight. Aggravation of the phosphorus is very important. When there is a thunderstorm, the phosphorus generally aggravated. Warm foods and the drink and change of the weather from getting wet in the hot weather, evening, lying on the left or a painful side during a thunderstorm, ascending a stairs, these are the aggravating factors for the phosphorus. In the dark, lying on the right side, cold food, open air, washing with the cold water and sleep are the general modalities, emulating modalities for the phosphorus. Passatilla. Passatilla lady or a passatilla female is a known for the wandering type of pain. When there is a shifting type of pain and emersion after the moving about in an open air, passatilla is a very good medicine for the prescription. The lady is a mild, gentle, yielding type of disposition, cries or weep very easily, suffering from worse from the affected limb hang down, drawing, tensive type of pain is there, sleeplessness is present, along with that in the pulsatilla, thirstlessness is there, which is aggravated from the eating the rich food. Even the GIT of the pulsatilla is aggravated from the eating the rich fatty food. There is a result into diarrhea. Towards the evening aggravation, warm room aggravation, retaining on a warm room aggravation, when allowing feet to hang down, there is a aggravation. Emersion from the motion, cold application, cold food and drinks, though the not thirsty. Ruta. Ruta is very fine medicine when the deep-seated muscle is involved along with the bone. There is generally a history of the injury, contusion, or carrying a heavy weights. Ruta also has a shooting type of pain. Sciatica worse when the lying down at a night, better during a daytime. Sleep wakes frequently. It is a worse during a damp or a cold weather. Feel bruised, sprains, overexertion. Result are called for the ruta, which is aggravated by the lying down, wet weather, and immersion after the warmth. Rustox. Bryonia and rustox are exactly opposite. Bryonia is emerged after the complete rest, and rustox is aggravated after the rest, and continuous motion of the rustox may be emerged. Rustox particularly act on the muscle fibers, where is overstraining of the muscle or exposure to the cold result into the any kind of the muscle pain. Sciatica pain, that is shooting, stitching type of pain, which is aggravated at the night, cannot sleep, which is aggravated from the cold. Beginning of the motion and the rest is aggravation, and immersion is the continuous motion, heat and warm thing. They, like the arnica, there is a lameness and a stiffness. The Rustock person, like the arnica, is also restless and search for the soft spot. Where getting up in the morning is very aggravating factor. Lameness and stiffness is present in the morning, but relieved in the continuous motion is the major key feature of the Rustocks. Immersion after the continuous motion. Delirium. Delirium is a very sensitive medicine and aggravated right-sided. Right-sided sciatica, the delirium is a very fine medicine to prescribe. Fear of being touched like a arnica, sensitive place, slow development of any symptom, and sciatic pain worse from the coughing, worse from the sneezing, or straining at a stool with the sensitiveness of the spine. Numbness is there, effect of the any kind of spinal injury or any kind of fall, result or called for the delirium medicine. Valeriana. Valeriana for the oversensitiveness of the any nerves, mental and physical disposition change suddenly and go to the extreme. Pain as spasmodic drawing type of pain with the heaviness, aggravated when the rest, standing, evening, and the immersion after the changing in the position, rubbing and after sleep. Sleepless with the pain, worse on the waking up, dreads of being alone, especially in the dark. Valeria is the for the oversensitive of the nerves which is aggravated after the rest. Synthesizer. It is specifically action on the nervous system. Neuralgic shooting pain in the limbs, picking sensation, shock, electric lag pain, as we see in the colosynth, is there. Numbness of the left side, impairment of the nerves of the motion due to the spinal disorder is there. Electrical pain all over the whole body, ailment after the any kind of injury or getting fit wet, suited to the person who is thin, emaciated, poor assimilation is present, and with the insomnia. As we all know, the miasmatic diagnosis is always also important in the cases of the sciatica. These are the miasmatic distribution of for the different type of the symptoms for the sciatica. Numbness, tingling comes under the psora, lancinating pain comes under the syphilis, movement aggravation comes under the syphilis, hot application aberration comes under the psora, stretching aberration comes under the psychotic. In the different properties, there is a rubrics for that. Extremities in the cant, it is given under the heading extremity, pain, lower limb, sciatica. We can see the bryonia, buforana, colosynthis, iris, megphos, nux vomica, rustox, delirium, caliaodum are the grade 3 mark medicine to prescribe. In the FATAC, we can see under the rubric sciatica, that is colosynthis, rustox, again, sepia, iodum, delirium is there. In the bodic repertory, it is given under the title of the sciatica. Type in the summer spine, which kind of pain is there? Plug-like sensation is there, splinter-like sensation is there, or a dieting-like sensation is there. From the modalities, aggravation and aberration, there is different medicine for the prescription of the sciatica. The Incidence of the sciatica is increased day by day because the lifestyle of the people are adapting, and it has become one of the very common problem in the affection of the people. In the modern medicine, they only offer the palliative treatment, and so one can also opt for the homeopathy for that. So we can say that after the administration of the homeopathic medicine, regain the control over the repeated episode of the pain, reduce the intensity of the sciatica pain, prevents the surgical intervention in its complication. So homeopathic medicines are quite effective for the reducing of the complaint of the patient, helps to prevent the surgery, helps to patient do not go for the surgery. This is a small effect to expand the knowledge of the homeopathic materia medica and the therapeutic indicated medicine for the sciatica. Thank you so much.
Thank you, Dr. Neha Kothadiya. It's really a very good session indeed. You really covered almost all part of this sciatica and its management with homeopathy. But you can come out with some of your cases if they're with you in the coming edition of your presentation, so that
Yeah,
that we are having a very less time in this hour, so we can have another session for the same. You can come up with some
sure,
cases. Anyway,
sure.
it is a time for discussion, and those who want to participate in the discussion may please raise your hand so that we will allow you to continue participate in the discussion. Already, Remadevi Ambadi madam has raised the hand. So, Ambadi madam, you can begin the session. Then I will go to Dr. Beatrice Dessner and then Dr. Hariharan sir. All please get ready. Please, please mute. Please unmute yourself. Please unmute, Ambadi madam. Okay. Please unmute.
Dr.
Okay.
Neha, it was a very good session. Very nicely you have explained every part of this sciatica. I want to
Thank you.
tell this one particular point, one tip. See, for
Yes,
chronic sciatica, Tranangulus bulbosa tincture can be
yes.
applied on the heel of the affected part. It gives
Okay.
good result. To tell that, I have raised my hand. Just a very good suggestion. Thank you.
Thank
Come
you.
again.
Thank you, ma'am. Thank you.
Okay, now it's up to Dr. Beatrice Dessner from Germany.
Yes, yes, thank you. So, thank you very much for the very excellent and brilliant session. It's as you are right, a very important topic. And one question for you. Are you specialized with your patients in orthopedic problems and sciatica? That's one question. And second question, in practice, I also see sometimes if the pains are starting, that I combine Bryonia and Rustox. Normally they are very different, but sometimes it's helping to start with Bryonia after 4 hours Rustox, after 4 hours Bryonia, and see which remedy is better. Dr. Hahnemann also is advising this. And my question, are you doing the same?
I have seen the lot of patients from suffering from the sciatica. I have not specialized in this, but I have seen major cases of the sciatica.
Yes. And the alternating therapy with Bryonia and Rustoxicodendron, you have heard about that?
Personally, I usually administered one medicine at a one time only because I follow the rule of the organ, and that's why.
Yes, yes. I
Being
also do, but in that case, sometimes I have a good effect. It's
Uh,
exception in my
I-
practice.
okay,
Okay, thank you.
thank you.
it's up to Dr. Hariharan sir to say a few words.
Okay, Dr. Neha. See, very nice presentation, very beautiful presentation. See, and I like to say one thing. Usually,
Yes, sir.
while I am treating sciatica patients, I will give I will check the vitamin D also
Yes, yes,
and vitamin D. So,
yes.
if the
This
vitamin
thing is
deficiency,
considered.
I am seeing vitamin D deficiency, I will I'll, try to give the vitamin D also. That is one thing. And another
Yes,
thing is that See, all the sciatica patients, I will give calcarea force 6x also.
Okay.
See, I think that will do good for the, see, herniation. See,
Mhm.
such a thing, calcarea force will do good. And it is also good for
Yes.
the bone, you know. See, that is my opinion. Okay.
Okay.
Very nice
Thank you.
presentation.
Thank you,
Thank you.
sir.
Yes.
Thank you,
Uh,
sir.
So now it's up to Dr. Ramprasad sir to say a few words, and then we will go to Dr. I.C. Bhavatkar. Please unmute. Please unmute. Only 2 minutes.
Thank you, Dr. Thaneji, and Namaskar, everyone. Congratulations, Dr. Neha.
Thank you,
Very
sir.
nice presentation, excellent session. Sciatica is a common disease,
Yes.
highly common disease, or very role of homeopathic medicine. Any describe the medicine like Nephelium. Nephelium is a very good remedy.
Yes.
Nephelium and calcarea phos, magnesia phos, Nephelium is a very good numbness, alternate with pain. Nephelium is a
Yes.
very good remedy. So very, very thanks. My clinic every day patient sciatica. So magnesia phos, colocin, calcarea phos, and miasmatic, role of miasmatic.
Yes.
Chronic sciatica, Medornum is a very good remedy, day aggravation pain, and Cipilnum is a very good remedy, night aggravation pain. So very,
Okay.
very
I will
thanks.
consider this. Thank you. Thank you, sir.
And now it's up to Dr. Bhavatkar.
Is it audible?
Yes, yes, yes.
Yes, yes. So one is for Dr. Jesner. Madam, for your query in 30 seconds, I'll answer you. Actually, when you give Bryonia and Rustox, they are alternating remedies, and our vital force gets confused while we apply the remedies because in rheumatism also patient applying. So Hahnemann has indicated
Totally
for
right. Yes.
cognates can be used sometimes, that Hahnemann has said. So I think we can think in that way.
Yes.
And
But
for
it's an
yeah,
exception. It's just an exception. I want to tell
yeah,
you.
yeah,
Yes.
no problem. And for Dr. Neha, it was a good presentation. Only one thing I'll add, in clinics, I've seen that the remedy cotyledon acts much better in old age patients having heart trouble with sciatica.
Okay.
And another remedy is Viscum album, where all hypertensive patients with sciatica, only on 2 indications we can give. They work very well.
Yes, yes,
Okay.
yes, yes.
Okay.
Yeah, yeah. So thanks for your lecture. It was very informative.
Thank you. Thank you,
Okay,
sir.
now we invite,
एक और है साइटिका के बारे में
okay, sir.
हम
Okay, sir. Now it's the time to wind up the
अच्छा
session.
अच्छा
We are
ठीक है
just-
हाँ काम बात का फ्लो हो पा रहा एक्सेस वर्क ऑफ एक्सेस वर्क
Yes. Yes, please, please say vote of thanks, Dr. Beatrice.
Oh, yes, yes. So, Dr. Neas, thank you very, very much for your really interesting and detailed presentation. I made photos of your slides because I would like to read them again and also tell also my colleagues in my group. Thank you so much. Thank you so much, IFPH. And
Thank
hoping to have many more nice and interesting sessions. Thank
Yes,
you.
definitely.
Yes.
Thank you, Dr. Beatrice, and thank you, Dr. Neha
Thank you.
Kothadia,
Thank you, sir.
and those who participate in the session. Tomorrow we will have a session from Dr. Iqbal Ansari. He's a classical homeopathy practitioner and practicing in Mumbai. And the subject of discussion will be importance of concomitant symptoms in homeopathy. So another big day is awaiting for you. You can all join in by using the same link, and you can watch the videos of the same on the tomorrow itself, so that those who miss the session can watch it again at searching IFPH homeopathy. So with that, we come to the end of the day 1612. It's up to Dr. P. Shaila to moderate